Welcome back to OMFS Essentials. In our last episode, we covered the principles of soft tissue handling. Today, we address hard tissue. Bone removal is a daily event in OMFS, whether for gaining access, performing osteotomies, or in jaw resections. The principles of handling bone are governed by one dominant factor: heat. The primary goal is to cut bone efficiently while avoiding thermal necrosis. 1. Rotary instruments, motors, and Burs. This is the most common method of bone cutting in OMFS. The critical danger, frictional heat, if the temperature of the bone rises above 40 degrees Celsius, osteoblasts release alkaline phosphatase, and bone necrosis will occur. How to prevent thermal necrosis? 1. Copious irrigation. This is the most important rule. Constant, copious irrigation with cold, normal saline must be used to dissipate heat. 2. Sharp burrs. A dull burr does not cut. It grinds, creating excessive friction and heat. 3. Correct Bur type. Use carbide or stainless steel burrs, which cut the bone. Avoid diamond burrs for bone cutting. They are abrasive and generate significantly more heat. Diamond burrs are more appropriate for odontectomy. 4. Ideal speed. The ideal speed is around 20,000 RPM. Very high speeds can generate excessive heat. Surgical technique. Start with a round burr. A round burr gets a good purchase on the bone and will not slip and injure adjacent soft tissue. Use the post-stamp incision. Drill a series of connected holes, like a postage stamp, to outline the cut. Connect the holes with a fissure burr to create a single continuous cut. Safety. Always protect and retract soft tissues. Never keep cotton or gauze pieces nearby, as they can be accidentally entangled by the rotating burr. 2. Chisels and osteotomes. These tools are used for controlled bone splitting or cutting. Key distinction: a chisel cuts the bone, an osteotome splits the bone. Precautions for use. 1. Stop cuts. Before splitting, vertical stop cuts must be made, usually with a burr, to control the fracture and prevent the split from propagating. 2. Support the jaw. The jaw must be well supported to prevent accidental fracture or dislocation of the TMJ. 3. Sharpness. The instrument must be sharp. 4. Mallet technique. Use controlled wrist movements with the mallet. Do not use heavy, full-arm blows. 5. Soft tissue protection. Always guard adjacent soft tissues, as a slip can cause significant injury. 3. Surgical saws. Jiggly saw and power saws. Jiggly saw. Description: a flexible wire saw held by two handles. Technique: use a seesaw action with long strokes. This uses the entire length of the saw. Using short, rapid strokes in one small area will dull that portion and cause the saw to break. Safety: requires constant saline irrigation and soft tissue protection. Power saws, oscillating, reciprocating, and sagittal. Description: motorized saws that provide very precise and fine cuts, often used in osteotomies. Safety: these also generate heat and require constant, copious irrigation. 4. Rongers, cutters, and files. These instruments are for removing or finishing bone. Bone cutter must be sharp. A dull bone cutter will crush the bone rather than cut it. Ronger or bone nibbler, as the name suggests, this instrument is for taking small bites of thin, sharp bone to smooth edges. Bone file or bone rasp, critical technique. A bone file is used to round off all sharp bone edges at the end of the procedure. It must be used in a pull motion only. The rationale: a to and fro or push-pull motion will clog the serrations with bone dust. This clogged file then acts like a dull burr, generating friction, heat, and causing bone necrosis. Summary: Handling bone is all about managing heat and preventing uncontrolled fractures. The key principles are: rotary instruments. Use sharp carbide burrs with copious cold saline irrigation to prevent thermal necrosis. Chisels or osteotomes. Always create stop cuts first and support the jaw to prevent unintended fractures. Bone saws. Use long, smooth strokes and constant irrigation. Bone files. Use in a pull stroke only to avoid clogging and heat generation. The difference between a cleanly healed osteotomy and a necrotic infected surgical site often comes down to these fundamental principles of hard tissue handling. Respect for the bone's biology is paramount. You've been listening to OMFS Essentials. As always, keep mastering the essentials.